Today's episode is one I am especially passionate about, not just as a provider, but as a mom in the thick of it too. We're talking about raising holistically well kids, and more specifically, the perspective shifts we have to make in motherhood in order to do that. Because raising kids who are thriving isn't about doing everything right or checking all of the wellness boxes. It's about intention, it's about presence, and it's about being willing to evolve right alongside of our children. So, what does it mean to raise holistically well kids anyway? Now, when I say holistically well, I don't mean perfectly organic, crunchy from day one, never ate a goldfish cracker kind of parenting. That's not real life, at least not mine. My kids go over to friends' houses. We get together with our extended family. They spend time with their cousins and their grandparents. And while I know what they are exposed to within our home and within what I give them fits that more crunchy mold, I know that's not where everybody else is at. And you know what? That's okay. I think understanding the fact that our kids need to be resilient is priority number one because we cannot put them in this perfect little box and expect that they are never going to be exposed to a food dye or a processed goldfish cracker, right? And as a mother doing the inner work, when we know those foods aren't good for our kid, to also know that having one package of goldfish crackers once every 3 months maybe is not going to kill them. Think about it, you know? I think sometimes we get so caught up in what is good, what is bad, and putting labels on things that it can damage the moment with your child and their spirit. And we have to think of parenting through a holistically well lens that we are looking at the whole child, their body, their nervous system, their beautiful little mind, and their spirit. So it is not just nutrition, it is not just physical health, it is also spiritual and emotional well being. And so it means that we are focused on, yes, their physical health, but also their emotional regulation. We are looking at connection with our child over controlling them, and modeling over micromanaging. Modeling, I mean, living the life we want them to live ourselves. If we are really focused on nutrition for our kids, how are you feeding yourself as a mother? Right? That's really important because they look up to you and they look to what you're doing to support your body to support their own. So I love teaching my kids to listen to their hunger cues instead of forcing them to clean their plate. And how this looks in real practice is that I will give them a small portion. We have those plates from Laylo. It's one of my favorite non-toxic keto brands, and it's divided into 3 parts. So I will put their protein in that biggest part. That's usually like our main course, if you will. And then in the smaller 2 sections, I will always put a fruit and a veggie. And a lot of times within our protein section, there's some vegetables in there too. You know, if I'm making meatballs, for instance, I might have shredded carrot or shredded zucchini within that meatball. Or if we might have some pasta there, then I will have that meatball there with it. And I will let my kids just have a small serving of each thing. I tell them they have to try each thing before they can get seconds of anything else. And maybe they are really loving the meatballs that day, which for instance has carrots and zucchini ground into it. Great, they can have extra of that, and maybe they don't want to eat their raw carrots that day. So I'm letting my child listen to their own hunger cues and their own taste buds, but also having them try everything on their plate. I'm not forcing them to clean every single section on their plate because I am giving them autonomy to make their own choice and listen to their own body. There's times where I don't feel like eating something on my plate, right? And I would not be happy if somebody forced me to do so. And that's okay. But I do want them to make sure they are getting enough nourishment from other places. And then this also looks like creating rhythms that support my child's sleep, digestion, and nervous system. So, what do rhythms surrounding sleep look like? Well, it's creating routine. And we know that between 9 o'clock p.m. and midnight is when the body gets the greatest amount of deep sleep. So, That is something that we try to stick with even on the weekends. Weekends we might push it to 10:30 if we are hanging out with friends, but we do not let our kids stay up past that. Typically, it has to be something rare like Christmas Eve or New Year's Eve, things like that, because they get the best sleep before midnight. And so that is going to support their nervous system. It's going to support their emotional regulation, their ability to rest and digest, to tap into that parasympathetic portion of their nervous system, digest their food, and remain regulated and not get constipated. So having those sleep routines is really important. Now, we do not do a bath every night. That for skin health can lead to drying out. For some, that works. I mean, baths that are nice and warm can certainly be calming to the nervous system. That can trigger that melatonin production and just that routine signaling it's time for bed. So if that rhythm works great for you, that is wonderful. For us, we do full bath nights like twice a week, 2 to 3 times a week, just to again allow for more of that natural skin barrier to stay on. And of course, if they are dirty, playing out in the mud in these spring and summer months, that might increase to more of a nightly thing as needed. But either way, we are having the lights dimmed. We are coming in around 8 o'clock p.m., dimming the lights, reading some books, getting into their pajamas. They know what to expect. So kind of that 8 to 8:30 time frame is when we do those nighttime care routines. We're putting on some tallow-based lotion, kind of massaging that into their skin. That is also super calming for their nervous system, that touch and that massage. And then we're cuddling up and putting them to bed. And so they're typically in bed by 8:30. Again, as we move into these summer months, maybe it's closer to 9 o'clock or a little bit past, but really trying our best to stick with that because it's going to support their overall health. And then modeling what it looks like to care for our own bodies. So, not from a place of shame or I need to lose weight or things like that, but rather from self respect. So, I often exercise with my kids. I'm in a life season where I have a 5 year old, a 3 year old, and a 1 year old. And so, finding time to go to the gym away from them is challenging, to be honest. And so most of my workouts are done in our basement when it comes to strength training. And I will have at least one, if not all three kids with me many of the times. And you know what? Sometimes they get on the ground and they are working out with me. They love to pick up my 5 pound weights and mimic what I am doing with my 15s. And it's really, really cute to see them reflect back what I am doing. And so when you are taking care of yourself, your kids see that. And there are studies out there that show that when the mother of the family, exercises and eats well, that the kids are so much more likely to do so too, even more so than if the father is healthy and exercises and takes good care of himself. And I think that's because our kids look up to us as the mother figure in the family. We are the caretaker, that primary caretaker most often. And if we aren't taking care of ourselves, what is that signaling to our children, right? So the truth is, our kids are watching. They're watching what we do more than they're listening. And they will mirror what we model because that is oftentimes how they learn best. So let's talk about some of the biggest mindset shifts I have had to make in motherhood, and maybe they'll resonate with you too. So, shift number one would be moving from a place of control to collaboration. Our kids are not ours to control. As much as we might try, we just can't control their little minds, right? And we're not meant to, but we are meant to guide them. They are individual people too, right? But we are meant to help guide them along this journey in life as they grow and learn new things. So it's easy to fall into the trap of thinking that being a good mom means controlling every outcome, their behavior, their food intake, their sleep, their emotions. But what I've learned, sometimes the hard way, is that trying to control often disconnects us. And the goal is connection. We cannot control the outcome, but we can help guide and connect with our child to help lead them to that optimal outcome. So, our job is not to raise perfectly behaved kids because, again, we can't control every single outcome, right? but it is to raise children that are self aware, that are emotionally intelligent humans who feel safe and supported, and who know how to tap into regulating activities to support their nervous system and to make good decisions. So, this might look like letting your toddler decide how much of their vegetables to eat on their plate, as I mentioned earlier, right? Versus forcing them or controlling the outcome of forcing them to eat every single piece placed on their plate. Or this may be listening to your kid's body language instead of forcing them into a hug if, they are sad and upset and just need some time to cool off in their room by themselves. And then to go in later and give them that hug and that connection that they need. So, collaboration honors the fact that our little ones' bodies are their own and we are there to guide them but not control them. So, just an interesting perspective shift. Number 1, moving from control to collaboration. Shift number 2 is doing it all to doing what matters most. So, we cannot physically, mentally, or emotionally do it all at one time, but you can do what aligns most with your values. So, this one hits deep for those of us who carry so many invisible mental loads, and there's this constant push pull to do more, to make the homemade snacks, to do the Pinterest craft, to make sure everything is all natural. The truth is, more does not always equal better, but doing what you can do best is what is most important. So I have learned to ask myself, what do I do best, right? What do I do best as a mother? And for me, that is the homemade snacks. I love making homemade snacks for my kids. But if that's not you, find good packaged snacks with healthier ingredients, right? Or simply get a whole apple and cut that up. That takes zero prep time, right? So understanding what you do best as a mom and just as a person in general, and then leaning into that when it comes to how you are supporting your kids in motherhood. I am not great at crafts. I get frustrated. I do not like buying supplies to make a craft that ends up just sitting there and then ends up in the trash eventually. Like, it's not my thing, and that's okay. And I've accepted that. But my daughter does love it, and she gets that in at school. And our nanny, who comes and takes care of the kiddos whenever I am treating patients at work, she's really good at crafts. And they make crafts together. And I have learned to let go of the fact that I need to do it all because I'm not the best at crafts, and that's okay. So she's still getting that in other areas, which is perfect, right? I love leaning into very natural products for my family and controlling that within our home, but learning to let go of control when we are outside of my home. My children do not have a super high sensitivity to things like food dyes or, preservatives. Yes. Do I notice a shift in them the days they have it when we are outside of the home and they're offered it from somebody else? Yes, I do. But it is not to a clinical level that I have to be extremely strict. So again, I do not bring food dyes in my home or heavily processed foods into my home, but if they are offered it by a friend's mother at the park, I don't make a big scene and I say it's okay. And that is for me personally because my kids might get a little extra hyper, but then I know they're able to down regulate, get back to baseline. And in my mind, that's building resiliency. So in those moments, ask yourself what actually matters here. Is my kid going to be okay if they have this snack? Or is my kid going to still feel safe and supported in their body if I don't make a homemade snack for them, but we get something that's of good quality that was prepared by somebody else or packaged? So, leaning into what you do well, filling in the gaps where you don't, and then also letting go of controlling every single aspect of what they're presented with outside of the home. Now, we eat real, nourishing food when we can, and then we give ourselves grace when we can. So, just remembering that you don't have to do it all of the time. Our bodies are meant to be resilient. And sometimes doing less, but with more intention, often creates more peace than trying to do it all. Shift number 3 of 4 would be moving from fixing to root cause curiosity. Now, symptoms are messengers, and they are not necessarily problems to shut down. So, this one definitely reflects the way that I practice clinically as well. If your child, for instance, has chronic congestion or skin rashes or stomach aches or behavioral changes, we want to always ask, what is the root cause? Is it because they are getting a lot of processed food and you're realizing, "Ooh, what I do have in the pantry here is actually not great quality." So you start making smarter swaps. You start replacing with better products and seeing how your kid responds. In our home, we have used this to explore things like emotional stressors, sleep disturbances, things like that. And I'm really grateful that we have had not huge setbacks when it comes to my little's health. But of course, things like the common cold pop up, and I am doing things like massage to their sinus cavities to help decongest and stimulate clearance. I am giving them a good abdominal massage if they haven't had a bowel movement in a day because we're staying proactive. And so I like to think by paying attention from the beginning and honestly from the moment of conception, from prior to conception, like those 3 months prior to conception are so important for laying the foundation to your baby's health in the womb. And then as you move through pregnancy and beyond, that I think that set up a really good foundation. But it doesn't mean that we're not presented with random symptoms that pop up and that we have to address. And so doing your best to think of what could the root be? Did anything change? Did we move recently and now my kid is having new symptoms and potentially we might have some mold in the house, right? Those are just things to think a little bit deeper than only surface level or let's put a band-aid on it with a pharmaceutical, right? I'll give a quick story here of a clinical patient who brought her daughter to me who was struggling with constipation, and they had been to Dayton Children's Hospital and were prescribed a number of medications. She had had to have a number of tests done, more invasive, and this little girl's a toddler, and nobody had talked to them about use of magnesium for helping to stimulate the gut. Nobody had talked to them about micronutrient needs and working that into her diet because she had some strong food preferences. But from a mother's lens, thinking of it in a way of how can we get some little micronutrients into the things she already likes. So she likes yogurt. What if we put some chia seeds in there or a little bit of flaxseed so that we're supporting what she already likes without overhauling everything because she didn't want to eat the carrot that was put in front of her or the applesauce or things like that. And so I also taught them abdominal massage so that we could help improve gut motility. We start from the right lower quadrant, we work up, we work across the diaphragm, and then down the left side. And that's going to assist bowel emptying. We worked on nighttime routines so that her body could feel safe and supported and move into that more parasympathetic rest and digest portion of her nervous system because that was always a struggle for them was bedtime and she hated the bath. And so we thought about ways to make it fun so that she did want to take a bath and put a little bit of Epsom salt in there to again help absorption of magnesium and micronutrients to support digestion and gut motility. And she is doing so good now. And so sometimes it's these really simple hacks, if you will, that are more holistic in nature that are just supporting your body's natural function from the start. And so, shift number 3 was from fixing to root cause curiosity and then leaning into that root cause curiosity for supporting the issues at hand. Now, our fourth and final shift is from quick fixes to long term foundations. And this I absolutely love because the goal isn't necessarily instant results, but it is slow, steady, and sustainable wellness. And this is where I feel like my family just thrives because I can let go of times that we're exposed to non optimal foods and things like that because we are in a long term state of more foundational wellness versus constantly reacting to quick fixes or to band aid approaches. So, we live in a culture of band aid parenting where We have a lot of distractions where we are quick to want to provide symptom relief or to do whatever works in the moment to make it better because we have to get on with life, right? And I get that. And we are tired and we are sometimes overextended. And sometimes a quick fix can be needed, but we really need to zoom out when raising holistically well kids and think about the long game. So, the rhythm of real food and real food exposure and developing a good palate for eating the rainbow, eating good fruits, vegetables, different proteins, meats. We're playing the long game here. And that is why I make sure my kids try everything on their plate so that they're being exposed to it repeatedly. And then before you know it, the 10th time, they're devouring all of that vegetable that they were previously saying they didn't like. In terms of zooming out, we're looking at the real food rhythm, but then also the habit of taking care of your body physically. So, movement, modeling movement for our children so that they are seeing us support our bodies through it, and then getting curious about supporting their body through movement themselves. My 5-year-old has been in gymnastics, and her favorite thing to do afterwards on Monday nights is take my husband and I through their warm up routine. So she brings us through a variety of stretches that honestly feel so good. And she is insanely flexible, way more than either of us. And it's so fun because she's teaching us now. And there are things that I wouldn't do on my own because they're specific to gymnastics now. And I did gymnastics back in the day, but it's really awesome seeing it through her eyes and then seeing her model it back to us. So cool. And then the tone of our home when it comes to nervous system regulation. This is absolutely huge. Again, go back and listen to episode 5 if you haven't. Episode 5, we dive into nervous system regulation. And this is where we set a tone of our home for a more parasympathetic state in a society that is in sympathetic nervous system overdrive. And if we're not careful, our kids will get into that overdrive state as well. Their natural tendency is calm and regulated. If you think of a little baby, right? But they regulate off of us. And so if our nervous system is not regulated, our little infant is going to be upregulated too. And then that's going to stay that way, right? So having practices where you hug your little one and you take a few deep breaths together when they are worked up, getting on their level, holding their hands, looking in their eye and saying, "Why are you upset right now, honey? Let's try to calm down." And what's really neat is I've seen this shift in my kids where yes, they have tantrums. Absolutely, especially my second child. He's a boy and he is all boy. But to be able to take them from that really overregulated state back down to baseline is so important. And staying calm yourself in that moment is going to make such a big difference because when you stay calm, it's going to make it easier for them to get back on that level. Now, these are the things that happen in the mundane, everyday rhythm of life, but there are choices that stack up. So it's not one big overall that we need to do all at once and then burn out, but rather choices that we make every single day to lead to these longer foundations of holistically well. So, a few more tangible ways to support your holistic wellness at home as a family. If you're wondering what this looks like practically, here are a few simple rhythms we try to weave into our home on a weekly basis. So, choosing non toxic options for cleaning and bath products where we can, honestly, everywhere at this point. Um, there are good swaps for everything. So if you go to my Instagram and you type in toolkit, if you DM me toolkit, I will send you a link to download my favorite cleaning supplies, home care products, all of that good stuff. I'll also link it in the show notes in case you're not on Instagram. And then family meals that prioritize protein, healthy fats, and digestive support. So every single meal, I'm looking at it as a way to provide love, nourishment, and support for my family. Of course, every meal is not absolutely perfect, but I do my best. And that's all I ask you to do too. Just do your best in the moment with what you have on hand. Prioritize a protein, a healthy fat, think like avocado or some olive oil, and then some digestive support. So that would be ensuring you're getting your fiber, so your fruits and your vegetables, okay? And then time outside every day, even if it's short. So I love to get outside with my kids in the morning. Oftentimes we wake up, we have a slow morning, we eat breakfast, and then we get outside. We'll get out into the backyard, get some fresh sunlight in their eyes, and that's going to help regulate their circadian rhythm so that when it is time for bedtime, their melatonin has had time to turn on because they had that clock start earlier in the day by getting outside. If it's winter, I am opening the curtains, just letting that sunlight stream in. We also have a red light, so perhaps I might turn that on to just stimulate that light therapy for them. All right, so tangible ways to support our holistic wellness at home. We have the choosing of non toxic products. We have family meals that prioritize protein, healthy fats, and then digestive support, such as our fruits and vegetables. We have time outside every day, and then movement, right? Let your child see you exercise and set time aside for that and prioritize it. Go on family walks after dinner, go on family bike rides so that they are moving with you. On the flip side, let your child see you to rest and relax and to take care of yourself in that way too, because them just seeing us go, go, go all of the time is that more upregulated nervous system state. And so having times where we are just relaxing, reading a book, or doing something that we enjoy, like for me, is spending time in the kitchen and cooking something new and letting them be a part of that is really helpful. And then also encouraging them to take those rest breaks for themselves too. And then breath work for the nervous system regulation piece, practicing breath work with them, listening back to episode 5 for a few different breath work techniques that you can practice together. And being careful with our word choices, right? So, tangible ways that this can look like in our home is just showing respect for yourself. Our children, again, they're watching us more than they're listening to what we're telling them, but they are hearing what we're talking about ourselves. They're curious, right? And so if you are constantly kind of body shaming yourself, think of that from your child's lens and finding ways to be proactive and positive in how you're supporting your own well being. So, to the mother who is listening and feels overwhelmed or maybe didn't grow up with these tools herself, let me remind you that you're already doing the work. Your awareness, your presence, your willingness to listen and grow alongside of your kids, that is the foundation of holistic parenting. You're evolving with them and you are learning as you go, and that is a beautiful thing. You do not need perfection. You need intention. You need to be able to make these intentional choices to better your quality of life as you move through. And you don't need all the answers. You don't need all the answers right away because honestly, every single answer doesn't quite exist, right? You need to stay open and connected, and the answers will find you. So you are doing beautifully. Keep staying curious, keep listening, and growing as you move through this journey of motherhood. So if this episode resonated with you, I would love to hear about it. DM me on Instagram at Dr. Kayla Borchers with one shift you're leaning into right now in your motherhood journey. Or share this episode with a friend who is trying to parent in a more connected and rooted way too. If you're looking for more support, whether it is physical, emotional, or educational, head to drkaylaborchers.com for programs and resources designed to support you and your family. Until next time, take care of yourself, trust your intuition as a mother, and remember, thriving is the new normal.